chronic Lyme disease, the hidden battlefield, and the oxygen therapy. No one talks about there's a version of Lyme disease that doesn't go away. Not after antibiotics, not after months, sometimes not after years. It lingers in the brain, in the joints, in the nervous system, and for the people living with it, it feels like being slowly erased. Hello? I am Dr. K. Paul Stoller, and I have a webinar wherein I discuss persister cells that get ignored by modern medicine and how to treat them. Lyme disease, caused by Borrelia burgdorferi, is the most common vector-borne illness in the United States. Over 400,000 new cases a year. Borrelia relapsing fever group is also in the mix. When caught early, it's treatable. But here's the problem. Few get treated early, and even when treated, the infection leaves persister cells, often labeled chronic Lyme disease. And this is where conventional medicine gets uncomfortable, because the symptoms are real, the suffering is real, but the appreciation that there are persister cells almost non-existent. Chronic Lyme doesn't stay in one place. The organism sets up communities where it wants. It spreads across systems. In the brain, it causes memory loss, confusion, irritability, dementia. In the nervous system, it causes tingling, sleep disruption. In the heart, it causes myocarditis, palpitations, chest pain, death. It's a system-wide breakdown. Standard of care creates chronic Lyme patients. Take a hypothetical 31-year-old man, healthy, active, functional. Then fever, fatigue, bone pain, neurological decline. He was treated, antibiotics, repeatedly for years, over and over, and yet the symptoms persisted. Cognitive dysfunction, pain, sleep disruption. His life stalled. Then something different was tried. Hyperbaric oxygen therapy. Not a drug, not a chemical, just oxygen under pressure. And what happened next was difficult to ignore. You see, Borrelia can't tolerate oxygen, and under pressure, the oxygen can even get past the protective biofilm. The mechanism is clear. Increased oxygen disrupts anaerobic pathogens. Reactive oxygen species may inhibit bacterial metabolism. Immune cells function better in oxygen-rich environments. Antibiotic effectiveness may improve. Even Borrelia itself is sensitive to its environment. Change the oxygen dynamics, and you may change the infection. Here's the problem. Standard of care doesn't recognize chronic Lyme. Some say
there's no persistent infection.
Others argue
we're simply not measuring it correctly.
And therapies like HBOT, they exist, but they sit outside standard protocols because it isn't making the medical cartel any money. Not rejected, not fully embraced, just ignored. Medicine doesn't just evolve through data. It evolves through discomfort, through anomalies, through cases that don't fit the model. This is one of those cases, and the question isn't, is this proven? The real question is, how many patients are still suffering because we haven't fully embraced an effective therapy because there is no profit in the cure? To learn more, go to kennethstollermd.com and learn how to diagnose and treat this disease.